Well, good morning. Good morning. Thank you so much for joining us. I'm Lisa McDuffie. I'm the president and CEO of the YWCA of Northwest Ohio, wearing two hats today, also serving as the equity chair of Healthy Lucas County under the direction of the wonderful Jan Ruma. It is really a pleasure to be able to greet you again, really in the name of a collaboration where two organizations are really working together to really educate our community and bring some important facts in front of you. So today's Lunch and Learn is no different than many of the others we have done. I think we have a fabulous group of individuals that are going to enlighten us on some really important facts about babies. It's relatively sad that in today's terms that we are talking about the fact that babies are dying. I mean, any baby that doesn't make it is just a devastating effect. But there is some data there that really tells a very important story. And so we're going to talk about some of that data and really begin to center around why Black babies are dying. And I'm a real big proponent on centering and focusing directly on the problem. And oftentimes when you center to the right and to the left, you will be able to bring those other individuals up and along after we've concentrated on really the center. And that's part of what we're going to do today. So let me get some of the particulars out of the way. I love to know who's with us. And so I'm sure the virtual world also wants to know, because we have this in webinar form. We can't see your wonderful faces, but start exercising your fingers and drop your name and the agency you represent in the chat so that we know you're awake and with us. Please do that now. That same chat feature is what we're going to use for question and answers. I see them coming in. Hey, Michael and Deshaun. That's right. Keep them coming. I love it. That same chat function is what we're going to use for Q&A. So at any time during today's program, something comes up, you need more information, feel free to drop it in the chat. We will communicate with you, if not immediately after the presentation. Sometimes depending on the speakers, they're also talented. They're able to stay on track and answer questions. So I'm going to leave that up to these wonderful folks and let them decide how they're really going to do it. Okay. Toward the end, we will also drop a link to an evaluation. If you joined us before, you've heard me say the Lunch and Learns are for the community. Anything you want to know more about, it's important for you to be very open and honest with us. Drop that information on your evaluation so that we can bring whatever it is you need front and center to you. I'm really, really excited because one of our next Lunch and Learns will be on the elderly. And that came as a direct result of several people saying, you know, how does equity really affect elderly? And so we're going to have some folks from the Area Office on Aging in a couple of sessions from now come and talk with us about that, okay? So let me also just say, just in terms of really important information, I have to tell you about Healthy Lucas County, just in case you need to know. Healthy Lucas County was formed in 1998. It is a coalition of community organizations working to improve the health of all Lucas County residents. We perform a triennial health assessment with data about children, youth, and adults, which develops the 3-year health improvement plan with strategies and action steps. This coalition especially is focusing on addressing the needs of residents living in low-income areas, lessening health disparities to help everyone live to their fullest potential. If you are interested in being a part of Healthy Lucas County, please check out the website, and I'm sure we're going to have that posted for you at some time during the program. Or many of you know Jan, you may know some of our panelists, reach out to them. It really is a fabulous way to make sure we are staying in contact with each other and all working collectively toward the same goal. So it would be great for you to be a part of that. So let me just tell you what we're really going to talk about here today. You see our title here, Why Black Babies Are Dying. And as I mentioned, it's important for us to understand it. I'm always quite sensitive that there are some folks who particularly question why we focus on people of color. And so I believe we have a data person who is an expert who's going to help us understand why it's important to follow the data. And that's Matthew O'Brien, who is from the Ohio Equity Institute. He's a program epidemiologist with Toledo's Lucas County Health Department. It is also equally as important to make sure we understand how we need to look at that data and how important it is to tell the story, the accurate story, so that we can begin to identify the root cause. And so we have Carly Salamoni, I hope I said that right, Carly, who is the director of Northwest Ohio Pathways Hub, who's going to really help us understand how we center the data and the information that's here. And then this is also equally as exciting. We have Jackie King, who works in Baby University. She's a community health worker. She is the boots on the ground and the person who is directly making an impact and changing the tide and how babies are really positioned to make it to their first birthdays and beyond. So ladies and gentlemen, it is such a pleasure for me to be able to set them up for what it is they are about to share with you. They provided me with some great talking points. And so I'm not even going to try to fix them up because they've done a wonderful job in how they presented it. So let me just read it to you. Infant mortality is the death of an infant before his or her first birthday, often considered a key indicator of the overall health of a region. The infant mortality rate is the number of infant deaths for every 1,000 live births. Okay. In the United States, an African-American woman with a master's degree has a higher chance of her baby dying in the first year of life than her white counterpart who has less than a high school diploma, according to Duke University Samuel DeBose Cook Center on Social Equity and Insight Center of Community Economic Development. The infant mortality rate among Lucas County African-American families in 2019 was 15.9 per 1,000 live births, compared to 9.4 per 1,000 live births, according to the ODH website. Safe sleep practices are one of the ways to prevent infant deaths, but 10% of Lucas County parents do not put the babies to sleep on their backs, according to the 2019-2020 Lucas County Community Health Assessment. Appropriate birth spacing, and I'm sure somebody's going to really break that down and make sure we understand what that means. For healthy pregnancies, 33% of Lucas County mothers had their children less than 27 months apart, according to the 2019-2020 Lucas County Health Assessment. Stress on mothers before and during pregnancy can negatively affect birth outcomes, and racial inequities increase those risks. Toxic, a Black woman's story, explores some of the factors that impact many Black women's experiences during pregnancy, setting the stage for robust conversation among healthcare staff, social service professionals, educators, policymakers, women, and their families about how to reduce infant death. Thank you so very much again for joining us for this presentation. It is my pleasure to turn it over to this team and let them take it away for a good hour. Matthew.
Thank you so much, Lisa. And so you touched up on a couple of these important pieces of what exactly infant mortality is. And so I just really want to quickly run through this. Infant mortality is any death that happens prior to 365 days of life. And this also includes stillbirth and fetal births, or fetal death rather, excuse me. And it's a very important marker for a community and the health of the overall society. And it's calculated by the number of infant deaths per a period of time divided by the total number of live births. It's multiplied by 1,000. And so we get a rate of X amount of deaths per 1,000 births. Before we look into Ohio specifically, I wanted to quickly highlight what exactly infant mortality looks like for the nation. And based on what the CDC data is for 2019, we see an overall infant mortality rate of 5.7 deaths per every 1,000 births for our entire nation. And this was actually divided up, and so we get 4.6 deaths per every 1,000 for non-Hispanic white babies. And then we also have a 10.8 for non-Hispanic Black babies. And so we're actually seeing a huge disparity and gap of around a little more than 2 times the rate of non-Hispanic Black babies dying at twice the rate of non-Hispanic white. And there's actually a goal that the nation has for having an infant mortality rate of 5 or less births per 1,000, or five or less deaths per 1,000 births. And so magnifying this over to Ohio, in 2019, the Ohio Department of Health actually had an infant mortality rate overall of 6.9 deaths per 1,000. And this was actually divided up into 5.1 for non-Hispanic white babies and 14.3 for non-Hispanic Black babies. And so we're actually seeing an increase when we're looking at Ohio compared to the overall nation, and we're seeing almost a triple the rate for non-Hispanic Black infant mortality compared to non-Hispanic white infant mortality.
Perfect. Thank you, Matthew, so much. There's a lot of questions about will the slides be available after. They will. This is also being recorded. However, we do have to stop the recording when we play the video for copyright issues. So that's just your forewarning. We are going to now show the film. It's about 22 minutes long. Before we do, and before I go into it a little bit, I did want you all to think about some questions now. And then we'll talk about them a little bit after as well. Here are our pre-screening questions. Do you think Black women have experiences that put their babies at greater risk during pregnancy? And what might be some of those experiences and risk factors? If you'd like to put it in the chat, you can as well as I'm asking the questions. What are some of the daily stressors pregnant working women experience? How might those experiences be exacerbated for Black women? And do you think healthcare providers generally treat all women in their care the same? So we're not going to answer these right now. We're not going to talk about them right now, but if you want to put your answers in the chat, you're more than welcome to. We want to make sure that we have plenty of time for our discussion after, and that we have plenty of time for our film. So I'm going to introduce the film for you now. I'm going to read a little blurb that they provide us. Toxic, a Black woman's story, explores a day in the life of Nina, a professional African-American woman in her second trimester of pregnancy. The film depicts the cumulative effects of the chronic stress Nina experiences as a normal part of her daily routine. These experiences begin from the moment she wakes up and continue throughout the day as she endures a myriad of stressful events that impact her health and well-being. So with that, I'm going to hopefully share my screen properly for everybody. Alright. So thank you for all of these comments and discussions. I could not see them when I was showing the video, so I'm really glad to see that people were active during that. We're gonna move to some discussion now, and I'm gonna bring our panel back together. And I want us to think about our pre-screening questions a little bit, and think about if any of the ideas, perceptions, thoughts that you had in regards to these questions before have changed since viewing the film. And then we're going to start talking through some of the comments in there, and then I'm going to ask Lisa to come back on to lead our discussion. So let's see. We have comorbid conditions, healthcare disparities. Yep. Some of the daily stressors, historical trauma and structural racism, particularly as it pertains to Black people and physical pain. That is absolutely true. Now we start seeing examples, right, that were brought in throughout the video. The lack of communication between the patient and the provider overlooked her concerns, daily stressors of work and caring for multiple children without family support, racial tensions in America, daily stressors of raising a Black son in America, prolonged stress, the stress of having natural hair and being yourself. Tasha, thank you for that. Facing stressors in the workplace, being the only African American, no quality fruits and vegetables in low-income neighborhoods, lack of access to fresh fruits and vegetables, food deserts. Also, I thought it was interesting the assumption that was made just because they were in that neighborhood, because they were Black, that, you know, he told them to swipe their SNAP card, right? African American are not heard when present health concerns to their doctors, whether that's in pregnancy or other issues. All the assumptions made in various environments, from work to school to stores, rooted in racism, and implicit and explicit. Yes, Cami, and I think we should get into that conversation a little bit more as well, right? The whole concept of implicit and explicit biases that we all have. No insurance, no prenatal care, proper care, no family history, day-to-day stress, other children, single. So these are maybe some experiences that make Black women at higher risk. Physician not listening to her. Yep. Here we go. As a mom and a nurse practitioner, I noted the 6-pound weight gain in one day at the beginning, as well as the disconnected demeanor of the OBGYN and not hearing the concerns. The systems create stressors. Here's some other ones we haven't talked about yet. The policy about hair at school, the justice system, the community violence, the healthcare system, busy providers needing more time to ask questions. We talked about the neighborhood stores without healthy options, disparities in the criminal justice system. That was another one I noted as well. No accountability, including from the media. Deshawn said that the hair issue happened to my niece at her new job a couple years ago. That happened in our community as well, if everybody remembers. And one of the things I failed to mention, but I think everybody knew, this film was actually made in Cleveland. It's about the Cleveland community. So I want to make sure everyone knows this wasn't like on the other side of the country, right? This was just in our back door. I think it's obvious that healthcare providers do not treat all women the same. The numbers do not lie, and stressors of the news and raising a Black child. So those were just the comments that we had throughout, but I really, really want to take this time to have some really deep discussion. We recognize the landscape of Cleveland, absolutely. All right, Celeste. Systems of care continue to follow policies and procedures that are founded on systemic racism. Absolutely, yes. I agree wholeheartedly. Any other general comments, discussions before I ask the panel, and then we start moving into questions? That we've selected here. Okay, Jackie, do you have anything to add at this point?
Oh, there I am. It is very interesting to see that this film was done the way it was. And with the lead character having the education she had, living in the suburbs that she lived in, being able to have the ability to have fruits and vegetables throughout her pregnancy, having one of the best doctors, so she didn't have to worry about if her insurance covered a particular hospital or, you know, things of that nature. And she still went through everything that she went through. So just to think about the lady that was behind her in the store, or the two ladies that were behind her in the store, who may not have had the option and the ability to have those things, and that's where they live. So, you know, they deal with that every day. They go to that store. They don't have the option to have fruits and vegetables in that neighborhood, which she will have that option. She was just stopping for a moment. She gets to go home. They are in that area. So it was just really interesting to see that she still had all of those issues being in the position that she's in financially, whereas, you know, socially, and still having to go through those things. So can you imagine not having that and having to live with it? So.
Absolutely. And I think you raise a good point. And they were very, the film was intentional about this, right? So they were very intentional about the woman that they chose to portray, right?
Absolutely.
An educated, successful Black woman who still is having these terrible outcomes, but they still showed a little bit of what the low-income community experiences, right? She experienced it for 5 minutes. They experienced, you know, so I wholeheartedly agree with you. And to work off of Lisa's talking point this morning from the beginning of the presentation, the Duke University study that showed that a Black woman with at least a college degree still had a higher infant mortality rate than a white woman with a high school diploma. The other thing that it showed, I'm going to pull this the link up to the entire study, but the other thing that it actually showed is that while for white women, education is a protective factor, right? So the higher your education level, the lower your infant mortality rate. What they actually see for Black women, the higher your education level, the higher the infant mortality rate. So it's not just a matter of Black women have higher infant mortality rates than white women. It's that what is a protective factor for a white woman is actually an increased stressor for a Black woman. So I'll put the link to the entire report into the chat for people to see, but I think that it's really powerful. And Jackie, I think you hit it right on the head there. So Alexi says, I had the same experience, lived in the suburbs, had healthy food, good insurance. OBGYN recommended a white coworker. I and one of my twins almost died due to substandard and neglectful care during the birthing process. And I am just so sorry to hear that. And that is part of the reason that we're having these conversations, right? And opening this up. We're going to get into the screening questions in a second, but one other thing I want to say before we start that came off of Celeste's comment, that systems of care continue to follow policies and procedures that are founded on systemic racism. There is a post going around on the internet, and it really breaks it down simply, right? You know, everybody is so quick to say that they are not themselves racist, right? In today's day and age. But think about it. You know, the policies were created a long time ago. Just like, think about it like a person who is disabled prior to the American Disabilities Act, right? Places were not meant for people with disabilities. Places were not built that way, right? So there weren't ramps. Things were not wheelchair accessible. People, you know, didn't have the protections. Once the ADA went into effect, buildings became ADA compliant, became accessible, right? But with us, the policies and systems that our country was built on are racist in and of themselves, right? We didn't go and fix them all and just solve racism. It wasn't as easy as building a ramp. So even though we say that as a society we're not racist, right? Celeste's point, we still have systems of care, following policies and procedures that were built on systemic racism, and just keeping it. So, Selena, do you want to move to the next slide? We definitely did hit on this. What do you believe are some of the sources of chronic stress in the lives of African Americans, particularly as it relates to infant mortality? And what role does toxic stress play in Black women's lives? And how does that stress affect babies? Anyone? I'm gonna invite Lisa in if she wants to comment on any of this. Anyone else have anything that we didn't already cover?
I am back, Carly and gang. Awesome, awesome presentation. And I could almost not wait to get back on the screen because my mind is going a mile a minute. And, you know, one of the things that I think the film left us with was that startling statistic at the very end that really just narrowed down to why. Why is it that this is acceptable in this country? And some may say it's not, but it is, because year after year, the statistics are again telling the story. Why? Why? In this day and age, we are all so very educated. We are woke, especially after the last year. But I have to put the challenge out. How many of us have aggressively stepped in to advocate for change, systemic change? And that's really the question that I want to lead with. Because if you think about, again, the statistics that Matthew shared, even what Carly has already put in front of us, there are things that we believe are definite triggers to why babies aren't living. And so I would like to, you know, compare it to any other epidemic in our community, things that we care about, we rally around and we work to change. Okay, and changing in this particular instance is more than a Facebook post. It's more than a bumper sticker. It is aggressively challenging the structural racism, as my friend Celeste put in the chat. And so that is part of why collectively we continue to bring education in front of Toledoans, because on any given day, and this is not my original line, but you know, somebody else used it and I'm gonna steal it. On any given day, for a person of color, if we center around African American on any given day, something could go wrong, just that quick. Doesn't matter how much money you have in the bank, doesn't matter your educational attainment, doesn't even matter which side of the railroad tracks you live on any given day, you could be faced with something that totally disrupts your life. And so when we think about all those wonderful things we expect women to be able to do as it relates to having normal, good, cushioned pregnancies, it's hard to take women of color out of the midst of that. Okay. There were so many things that were put in the chat box that I think the film did an excellent job of really singling and pointing to. But at the same time, for those of you who have been pregnant, just think about normal stress. Doesn't matter the color of your skin, just normal stress. I mean, I can share with you my first pregnancy, normal stress was, oh my gosh, am I doing it right? You know, the doctor said, do this. So I pulled the book out and I started reading to make sure I was doing it right. But I guess I have a question directly for Jackie. You know, again, I keep seeing our boots on the ground. What do you see or what do you say to empower women who may be encountering someone that has silenced their voice. Because there's a whole issue here that this film brings out that, again, it doesn't really matter your educational level, you're still going to be silenced. I can tell you, I was silenced. The doctor literally told me, stop reading, Mom. That's my job. Excuse me?
Most definitely. They are, I have a young lady now who just flat out refuses to go to a doctor because she feels that her voice is not being heard, her worries are not going to be met. Like, she just is refusing to go. I did finally get her to make her appointment, but it was me telling her, write the questions down, keep advocating for yourself, keep speaking for you and your child. You have to be healthy and you have to be safe. And I understand, but we have to figure out. So you're going to have to advocate for your baby and you have to advocate for yourself. So if they brush you off, you have a sheet of paper in your hand saying, hey, these are my questions. Making sure that that person also, if that doctor is not supporting them, let us find you someone else who will listen to you. Making sure that they are safe with me, making sure that they feel comfortable telling me what those issues are and what's going on. So if I have to make a call and say, hey, she's not doing right, or this is not normal, can she come in? That she feels safe with me. And I think one of my old bosses used to say, how do you eat an elephant? A piece at a time. If you look at the big, huge picture, you become so overwhelmed with everything. You have to find out, what can we do and how can I help? So yes, I have a lot of young women who feel that their voice is just not being, they don't matter. And that's a horrible way to feel with being pregnant and a first-time mom, young and just not understanding. So I hope that helped. I hope that answered.
Absolutely, it did. And I was actually trying to get to the chat because I've seen a point come up. When I was a community health worker, I had to educate so many moms that they could speak up and ask questions during their doctor's appointments. So many did not feel comfortable asking questions and felt their appointments were not important. And thank you, Ellen, for that, because that's really why I asked the question to Jackie, because I know that that is true. It's hard in some instances to empower our folks to understand that they pay the doctors.
Yep.
They are the employer in this
Right.
particular situation. And so if you're not getting what you need, be so inclined to find someone else. And so, Jackie, I think, it is so totally awesome that there are community health workers out there really helping to make that happen for
Right.
our moms in our community.
I'm all about, if you don't feel comfortable with a doctor, if that midwife is not listening to you, then we need to find someone who will. And you have that right to do that. You have that right. And I don't think that we understand that we have that right to feel comfortable with the person that's looking at us as a whole. And if you want someone to take care of their health, how can I talk to you if I don't feel comfortable with you about my health? So starts from the beginning.
So tell us a little bit more, and this is really for Jackie or Carly, maybe, or Selena. Tell us a little bit more about the training that community health workers really undergo and how you are equipped to really, again, implement an empowerment model that really meets the individual where they are, but also walks them down a journey of understanding what is the best position to have your child go to sleep, how often you need to go to the doctor, and not going to the doctor is not going to help at all. How do you begin to introduce those things through the training in the program that you have implemented for the community?
So I think it's multiple factors, and I'll touch on it a little bit, but I want Jackie to also chime in here. But I think that, there's curriculums and there's certification through the Board of Nursing, and there's all of those things. But I think at the end of the day, one of the biggest pieces in the success of a community health worker is their own lived experience and their ability to understand, right, what other people are going through and build those trusting relationships with their clients. Like I said, we do utilize a parent education curriculum that starts prenatally. We do provide ongoing trainings on a variety of, different things around safe sleep and parenting and what to expect. And they do go through certification through the Board of Nursing. So there's those basic health components to it. But I think at the end of the day, you can study a textbook and train in a curriculum all you want, but it is the real world experience that makes a difference in that. Jackie, do you have anything to add to that? I say as you're coughing.
I definitely believe that having the education that we do have in the trainings and making sure that we stay up to date with what's going on and the basic knowledge, but really and truthfully, it does come off of your experience and reaching someone where they're at, talking to them where they are at that moment, not where you want them to be, not where they should be, but where they are, and making sure that, again, they feel comfortable enough to trust you for you to take them to somewhere else. Okay, so we're going to make this doctor's appointment, and these are the reasons why. And so outside of the reasons why, you need to make sure you're safe and healthy. So we have to start with you. If we can make sure you're safe and healthy, then that doctor can also make sure your baby is safe and healthy. Mm-hmm. So whatever, and to me, it's wherever they're at and the reasons why they're not going to the doctor, that's on me to give them reasons why to go to the doctor. Not just because of how I feel about it or what, everyone else is saying that they need to do. I have to read them and figure out where they're at and find those barriers that's happening to them, because each person is different.
And Jackie, I think, and sorry, I didn't mean to intervene, Lisa, but I think exactly what you said is at the end of the day is what everyone needs to be doing when coming in contact with any person, right? I mean, I think that community health workers have a very specialized skill set, but at the end of the day, they also practice empathy and listening, right? And if we as a community, if we as providers and agencies and community representatives, if we are listening and engaging, right, and really hearing what's going on and just taking a minute to listen and help the people who are coming to us, moving forward, maybe people won't be so afraid to come to us. Maybe people will look forward to going to see their doctor because it's just like they do see that, like they look forward to seeing their community health worker because it's another person who is there to help them, who cares about them, who listens to them. Maybe when there aren't a lot of people like that.
And also with that, you're also building their self-esteem and their confidence up to talk to someone in their family who may have went through the same thing. So you're just not working with one person. It's opening a door for however many people, even if they don't come to us, you have someone now who's been through it that's like, hey, no, this is the reason why you got to go. This is the reason why you need to do this. So you're planting something in someone else that hopefully will nourish other people, not just them, but their family members, friends.
No, absolutely love it. Great information. Let's talk just a little bit, and I think Carly referenced this a little earlier. And so I'll center the question around, hopefully the listening audience understands, that not all healthcare professionals operate in such a way of providing discriminatory inequities. Not all, okay? But just like in every single sector of our fabric of our community, there are some who give all the rest of the folks a bad rap. And so it's important to be able to call those folks out. And again, one of the best ways to do that is by those allies that get it and understand coming forward to help be the voice. And so I guess my question is, is there anything that is done directly in the healthcare arena that helps one, identify unconscious bias, but also works on a peer-to-peer level to ensure that anything you might have been taught that's a thinking error gets eradicated so that you don't begin to operate and tiptoe into this area that is, again, preventing women of color from living and preventing babies from seeing their first birthdays and beyond.
So I would like to encourage anyone who's in the healthcare systems who may be doing any of that work to comment in the chat box about that, because I am not a healthcare professional. I'm on the public health side, so I don't want to speak for professionals, although I do know that there are trainings that are available on implicit biases. We've done Bridges to Health and Healthcare trainings before, which is really the Bridges Out of Poverty training for healthcare professionals, which really goes more towards the poverty side of things than the racism component. But there's a lot out there right now that can be provided if healthcare providers and health systems are interested in getting that training. I think to a point, Lisa, it goes back to what you were talking about in the beginning, right? Being actively going against racism, not just putting out a Facebook post, just putting a bumper sticker on our car, but calling it out for what it is in the moment as peers, to really, start to make those changes. As community health workers, they can say, okay, well, I know these other doctors who are going to treat you well. If you don't feel like you've been respected at those places, they will respect you here, and they do care about you here. But community health workers can't go to a physician and say, you need to not be racist, right? Like, that's not their role. That's the role of other professionals in that field, to call each other out, to educate each other, and to recognize them.
No, I think you're absolutely right. I think it's important, again, for us to acknowledge that we each have a role to play here. But again, it's important for us to make sure the necessary people that are in policy-making positions hear it and understand that our community is not tolerant of it. And so I think it'd be really interesting, because community health workers have been on the scene now for just a little while, but, I think it'd be really, really interesting to see longitudinally, how we begin to make a difference. And, to be perfectly honest, and this is my plug for community health workers, there's simply just not enough money and enough of them to go around to really begin to change the tide at the pace and the rate we really need it. So again, let's get on our horns, let's sit down at our computers and begin to lobby our legislators to really push for change. It's more than, again, just the notion of little Black babies dying. No babies should die, none. This is America.
Absolutely. We have some comments in the chat. The dismissal of Nina's concern, aside from being frustrating to her, likely contributed to the loss of her child. It obviously led Nina to think she was overreacting and or not having the self-confidence to push the matter and seek additional care about her immediate concerns. Alyssa from the health department, I listened to a podcast called Hidden Brain that discussed training for implicit bias is as not helpful as it is unconscious, but what would be more helpful is checklists that need to be followed that prompt healthcare workers to address items that need to be addressed. Gwen from the health department, one of the main things that must universally happen is educate clinicians to be mindful of profiling even when they do not feel as though they are doing so. To listen to all clients universally without doctoring culture is paramount.
Mm-hmm.
Wayne, the health department's on fire here. I complete every survey, make phone calls, especially when my care is not as great as I'd hoped. Dana says the March of Dimes has an implicit bias training. And Celeste, great question, Lisa. Those that are currently in charge are the problem. Systems of care are fine with saying that they are offering trainings around racism. A lot of just checking the boxes is happening. We have to start being intentional about who we are electing to represent U.S. on local, state, and federal levels. Absolutely.
Amen, Celeste. You know what, let's go back to something that I think Dwayne dropped it in. I'm curious with our listening audience, if the care isn't sufficient, how many of you take the time to follow up, complete the survey that's sent to you, and or pick up the phone or email to voice that concern? And we'll just pause a minute and see. So we got some folks saying they do.
I will say I did not when I was younger.
Okay. So we got some folks acknowledging that, you know, it's intimidating. Okay. So Dwayne, I think that in itself is an excellent takeaway for all of our listeners here. Not only do we need to do it ourselves, and again, I say it from the perspective of those of us who happen to be people of color, but I'm saying overall, generally, if the care isn't what it needs to be, we should be documenting that, okay? And I do know enough to understand that if enough people are talking about it and writing about it, that there are some patient experience officers that take note of that. So I would encourage us to do it as professionals. I would encourage us to share that tidbit with our circle of influence, and in particular, those folks that we serve every single day that may be encountering, again, unjust practices, okay? I think it's good to make a phone call, but let's begin to document it, because that's, again, one of those things that we'll be able to go back and be able to push and measure over time, okay? Trying to see any other thoughts here. We have just a little bit more time, so if there are any other questions, feel free to drop them in. Hey, Tycee. It looks like she says, I like to show appreciation when it's due and concern when it's appropriate. Nita's doctor should have had compassion as a person and not just been a doctor. Definitely the case. Okay. I'll give it just a few minutes to see if there are any other parting words before we sign off. It looks like Matthew's joined us. Any questions for Matthew related to the data? Carly, Salima?
Well, Matthew's gonna actually share the latest data.
Oh, perfect. Take it away, Matthew.
Thank you so much, Lisa. And so we've talked about what the nation and the state of Ohio looks like, I want to sort of rein it in now and talk about what this data looks like for Lucas County in 2020. And so just to give a little background information, I also looked at 2019's data. And from that data, we see that there is a 9.4 deaths for every 1,000 births overall for infant mortality. And that's broken down to 6.6 deaths for non-Hispanic white babies, and then 15.9 for non-Hispanic Black babies. And so we're seeing a close to a 3-time rate difference here between non-Hispanic Black compared to non-Hispanic white babies. And so there's this huge gap and disparity that we need to address within Lucas County. And so if we can go to the next slide, go back one more. So 2020's data, we're seeing an increase from 2019. So we're seeing actually an increase of almost 2 deaths overall compared to the last year per 1,000 births. And so this is broken down into 8 deaths per 1,000 for non-Hispanic white infant mortality and 17.2 for non-Hispanic Black infant mortality, which is again almost a 3 times rate increase compared to non-Hispanic white. But that rate is incredibly high compared to even last year, or 2019 rather. Next slide, please. And so I just wanted to give an overview here of where we are in Lucas County for 2020 compared to what the national rate looks like back in 2019. And so we're at a far stretch from where we need to be. And that's really what I wanted to highlight here.
Not going the right way.
So yeah, in this slide, there's a lot of numbers here, but what I really wanted to highlight was on that far right corner, that far right column here is the total for the year. And so we had around 5,000, a little over 5,000 births total for Lucas County. And then I split that up between the non-Hispanic white births and non-Hispanic Black births. And I really wanted to highlight that 12% of our total births were premature births. And additionally, we have roughly around 10% of our total births were categorized as very low or low birth weights as well. So there is a large percentage of our births are being categorized as premature and low birth weight. This is just I wanted to sort of simplify that visual of between our births here. And so I really just wanted to show that a majority of our births are non-Hispanic white babies, and then followed by non-Hispanic Black, and then Hispanic. And just to sort of make sure that we get the point is that there's this huge gap, and we've got almost half of our infant mortality is coming from non-Hispanic Black infant mortality. And so compared to the fact that Black infants make up less than a third of our total births, and we're seeing over almost half of them are infant mortality, there's just this huge gap that we need to address. And so next, I want to talk about the leading causes of infant mortality for Lucas County. And so the top leading causes are prematurity, congenital birth defects, sudden unexplained infant death, and obstetric conditions. And the one that I really want to talk to you mainly about today is prematurity, which is deliveries that occur prior to 37 weeks of pregnancy. And what we see in tandem with this is low birth weight and very low birth weight. And another one I want to talk about is obstetric conditions, and an important factor there is prenatal visits. So I wanted to just show and visualize just how this is broken down, and what we see is prematurity is our #1 leading cause of infant mortality in Lucas County, and then followed by congenital, SUID, and obstetric conditions. And then we also have additional factors that are mainly infections. And then this other category is due to the fact that our 2020 data is still preliminary. We haven't completely finalized it with ODH. This other category can be potential pendaces that could be classified as one of these causes of death that I've already mentioned.
Matthew, quick question. How does the data look by age?
That's a great question, and I will be actually talking about that later in the slides.
Perfect.
And so the next area I wanted to talk about is birth weight. And so what I really wanted to take away from this slide is that the vast majority of our infant mortality is in the birth categories that are being categorized as low birth weight and very low birth weight. And we have approximately 60% of our infant mortality is in those birth weight categories. Next slide, please. And so I wanted to also look at that in a historical sense. And so this is the previous 10 years of data that we see. And just like what we're seeing in 2020, the vast majority of our infant mortality by birth weight is in the very low birth weight category. And it really does take up the majority of our infant mortality. Next slide, please. All right, and then now the next slide I wanted to look at is I wanted to break it down by insurance for our mothers. And so what we see is that in infant mortality, the vast majority of our mothers are on Medicaid, at about 60% of them. And this is a majority of them are actually Black mothers are on our Medicaid at around 57% of those. And followed by private insurance at 24% of our infant mortality. And this is actually a majority of these are white mothers who are at 86% of them are on private insurance.
Mm-hmm.
And so I just wanted to sort of look at both the birth weight and insurance information. And I wanted to base it off of the average number of prenatal care visits these mothers have. And what we're seeing is that mothers that are on Medicaid are going to far less frequent average prenatal care visits. And so in terms of a healthy baby, our general population is seeing an average of about 12 prenatal care visits prior to delivery. And so when it comes to very low birth weight and low birth weight, we're seeing our mothers on Medicaid are going at about a third of the rate as what our average population is doing. And so we are incredibly low in terms of getting mothers on Medicaid to go to prenatal care visits. And I just wanted to break down average number of prenatal care visits by cause of death. And what we're seeing is that SUID and congenital birth defect causes of death, mothers are going at about the rate that we want to see these mothers going to, but prematurity and obstetric conditions we're seeing far less frequently that they're going to prenatal care visits. And this is just a decade of historical data, and we're seeing that that's pretty much the case here. And as I talked about, our birth population is seeing an average number of 12 prenatal care visits. And so this slide, we're going to be talking about age distribution for our mothers. And so what I really want you to focus on is the gray, yellow, and blue lines here. And what we're seeing is that a vast majority of our mothers that are giving birth to infant mortality events are mothers that are in their 20s and early 30s. And so I think that's an important factor that we want to consider, is that we're not seeing mothers that are that are on the older side or on the younger side. We're seeing mothers that are generally considered the normal birthing population. And I think that's an important factor that I want to highlight here. And I sort of want to just leave it off here at where exactly we're seeing these infant mortality events. And so these are our priority zip codes for 2020. And the next slide, I also did a historical background for that last 10 years, just to see where exactly those priority events were for previously as well, and to see whether or not there's a moving target here, or if this is sort of staying the same. Thank you so much. And if you have any questions, please let me know.
Thank you so much, Matthew. So, you know what, Selena, I wonder if we can go back a second. I was just curious and my eyes didn't move that fast. What zip code is the most concentrated with infant mortality? So what is that, 05?
So yeah, '05 is our highest number of deaths, but we also have the one of the highest number of births in that zip code as well.
That zip code as well, okay. All right. So it sounds like there's a whole combination of things that Matthew has just shared with us. And for those of you who work on a regular basis with parents, even those individuals that are of parenting ages, you know, it's important to make sure, again, that we are equipping ourselves to do all that we can to provide education with childbearing age women. I'm curious to see if Jackie has any parting words before we all jump off the screen in terms of what you see as needs or what the community can do to embrace and help you in your job. You know, really, again, just make a substantial impact to change the trajectory of really what we continue to see, even in Lucas County.
Well, being supportive, talking when you guys are having problems at doctor's offices, making those, if you show that you can speak up for yourself, it will help someone else speak up for themselves. So just being, like you said, being that voice, talking to the legislations, talking to the people in charge, being comfortable and confident enough to talk to providers when they are not doing what they need to do, calling people out, calling these professionals out. And then, you know, you always have the hub where if you know of someone who is eligible for our program, please encourage them to sign up, to call the hub so that they can be part of us and that we can help them and support them through this journey too.
Great, 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 great. Carly, you get the last word.
Perfect. Well, I think that we can't tell you all of these things without telling you what needs to be done or what we can do or what you can do. So a couple quick wrap up call to actions. If you are interested in helping us, you know, move the needle and save our babies in our community, we are relaunching the Getting to One Coalition based on all of the data that Matthew presented. Excuse me. And we will be meeting July 26th at 2 p.m. via Zoom, I believe it's Teams. So definitely you can scan the QR code to get registered. You can reach out to Ellen, who is our new Getting to One program coordinator. She just put everything in the chat as well. So we definitely encourage everybody to get involved because that's the first step, right? Is getting involved if you are able. And then if we go to the next slide, we do have, this came straight from the guide for toxic about some things that you can do in the community. It is 14 things, and I am not going to go through all of them, but I encourage you to look at the slides when you receive them, and to look at the ones that apply to you. There are different things around reviewing maternity, paternity, and family leave policies, how healthcare systems can be addressing this, how OBGYNs can work as part of the healthcare team to look at different protocols in place, what managed care plans can do, what we can do, what legislators can do. They will be larger when they're sent out because they will be, you'll have the whole screen to look at. I think that number 12 is really important too, and somebody hit on it, right? It's getting at and educating people before they get into the healthcare field. So encouraging higher education organizations to develop and implement plans for ongoing race and health disparity training. Encouraging policymakers, all of the things we've been talking about. So, and definitely visit www.toxicshortfilm.com. I want to thank everybody for coming out today. This is, I'm really excited to see all of the conversation. This is a huge passion of mine. I think that every single person in our community has a role to play in getting our babies to their first birthdays and beyond. And so I really appreciate everybody taking this small step by being part of our webinar today and our Lunch and Learn to learn and start to advocate. So.
Thank you,
Oh, yeah,
Carly, and thank you to our listening audience for sticking with us for this power hour. You know, I'm going to make a shameless plug for the YWCA. Just last week, our Ohio delegation ascended on Capitol Hill virtual style for our lobby day. And our primary focus was racism as a public health crisis. I encourage you to check it out at our website. And really what we are pushing for is a change in not only the structure that is in place that continues to perpetuate racial inequity, but we are pushing for funds in order to look at all the epidemics that are in front of us and begin to dismantle really the ills that we are stuck with, okay? And so I encourage you, if you're so inclined, to pick up the phone, send an email to encourage our legislation to adapt that. And it is much more than an ordinance. Folks have heard me say, you know, I am so very happy and proud that we have passed declarations, but words on a piece of paper will not make change. We've got to put action behind it. So it's my hope that this has been educational for you. There's a number of resources that's been provided. Check out the YWCA website for more information on Lunch and Learns and other services that we provide. Until next month, thank you so very much and have a great rest of the day.